Well, I'm going to go ahead and make the introduction today and get started here, and so we can stay on time. And again, everybody, thank you for joining us for again this month's Pepper Center Grand Rounds. I'm very delighted to introduce our presenter today. Dr. Brian Downer from the University of Texas Medical Branch will be presenting on climate, environment, and vulnerable populations, natural disasters, and their effects on nursing home residents. And I was really excited to have that Dr. Donner invited our invitation. I got to meet him a bit ago when I came down to the UTMB Pepper Center and was a visiting faculty member there and got to know his research, which really aligns really well with our Northwestern agenda as well. But Dr. Donner is an associate professor in the Department of Population Health and Health Disparities in the School of Public and Population Health at UTMB. And he's the program director for the Rehabilitation Sciences and Population Health Sciences doctoral programs, and also co-lead of the UTMB Pepper Center Pilot and Exploratory Studies Core. Brian is an active research program investigating how exposures to social and environmental determinants of health over the life course influence the cognitive, physical, and mental health of older adults. And again, really excited to have this presentation. I think it's very timely. And to that, I'm going to turn it over to you, Brian.
Yeah, thanks for that. Really excited to be here and give this presentation. I guess I'll mention, so most of my research up until maybe last year or 2 years ago is really focused on more social determinants of health, both from a population health perspective and then also doing a lot of more health services research related to outcomes of nursing home care. And so I'm excited to give this presentation because it's kind of moving my research into more of the environmental components of health. And in particular, how major climate and weather events, natural disasters affect older adults' health. And I'm particularly interested in the health of nursing home residents. So really glad to have the opportunity to share some of the new research my colleagues and I have been doing over the last couple of months. So just for a real quick outline, so I'll first give a little bit of a history of Galveston, talk about kind of Galveston's experience with major hurricanes, and then I'll summarize some evidence on the effects that hurricanes have on nursing home residents. And I'll kind of use that as just some background into new results from some ongoing research that my colleagues and I are doing on Texas nursing homes preparedness for hurricanes and similar types of disasters. And then I guess the last third or so of the presentation, this will be when I'll share some results from some recently completed work looking at the effects of power outages during a pretty major winter storm that happened a few years ago on nursing homes, on the residents' healthcare outcomes, specifically among long stay nursing home residents. And I'll keep an eye on time. I should leave enough time for questions at the end. I don't have the chat pulled up, but if people want to put in questions and if they have clarifying things that they want me to go over during the presentation, just let me know. I'm happy to take questions as we go. So if you're not familiar with Galveston, it's a small barrier island off the coast in the Gulf of Mexico. It's about, I guess, 70 miles or so south of Houston. It's not a real big island. The population is about 50,000 or so. It's mostly a tourist destination. Depending on who you talk to, it's a tourist destination because of the beaches, but also has a very large cruise industry. So a lot of people come down to leave for cruises into the Gulf of Mexico. Galveston also knows how to throw a pretty good party, I would say, especially this time of year. We're kind of swinging into Mardi Gras. So these next two weeks are a fun time to be in Galveston. Given Galveston's location in the southeast part of Texas, it's no stranger to major hurricanes. This map here from a few years ago, so it's highlighting, I think, three of the most notable hurricanes that I'll go into a little bit of detail in particular, the 1900 Galveston hurricane, which was a Category 4 hurricane in the year 1900. Next was Hurricane Ike in 2008. This was a Category 2 hurricane, so not quite as strong, but still brought an incredible amount of just damage, devastation to the Galveston area. And then the one that I was personally experienced was Hurricane Harvey in 2017. This one got a lot of national attention, mainly because it didn't so much affect Galveston Island. It was mostly the Houston and kind of surrounding areas got just an incredible amount of rainfall. And so there was some pretty incredible pictures with just the flooding and things. It was pretty incredible. So Texas holds the unfortunate distinction of having the deadliest natural disaster in U.S. history. So historians estimate that the 1900 hurricane had anywhere from 10,000 to 12,000 fatalities, which about 6,000 of those happening to people living on Galveston Island. Obviously, in 1900, there just wasn't the technology that we have today in terms of forecasting and alerting people to an impending storm. Even though it was a Category 4 hurricane, winds upwards of 120 miles an hour, it wasn't the wind and things that had caused most fatalities. It was the massive storm surge. So this massive amount of water just inundated the island with about 16 feet of water. And that was really the part that made the storm the most deadly. Before 1900, so Galveston was this just thriving city. It was known as the Wall Street of the South. It was a very wealthy city, and so this storm really changed the course of history for the island. After the storm, a massive rebuilding effort went into place. The two major projects were, one, to basically elevate the island and raise the elevation, and that's what you can see in these pictures here. So the way they did it, I don't fully understand. They actually kind of use a similar technique to expand the beaches, but they would basically just pump in a bunch of sand to raise up the island, and then they would put all the homes and buildings and things on stilts. And so they basically elevated the island that way. The second major project was building this pretty ambitious seawall. You can see parts of it here. So the initial section was completed in 1904, the seawall, and it was 3 miles long, about 5 feet wide, and at its tallest point, it was 17 feet tall. The initial seawall, as I said, was completed in 1904. The grading to increase the elevation of the island, that wasn't completed until a little bit later in the 1910, 1911. But these major engineering undertakings really paid pretty immediate dividends, because Galveston was then hit later with hurricanes in 1909 and then again in 1915. So they were able to at least make the impacts of those less substantial than what they would have been had they not made those changes. This is an aerial shot of Galveston, kind of highlighting how the seawall has been expanded over the years. So this is that initial 3 mile or so segment that was built after the 1900 hurricane, and they've been kind of expanding it. And here is kind of where the seawall is today. So this stretch here is a little over 10 miles. So it's a continuous pedestrian sidewalk. I was reading some information that it might in fact be the longest kind of continuous sidewalk in the United States, but spans over 10 miles. It's 17 feet tall, so it really does. It's a major kind of protector of the island, in particular for storm surge for hurricanes. Just real quickly, I won't go into as much detail for these, just in the interest of time. But as I mentioned, Hurricane Ike happened in 2008. And Ike was pretty much a direct hit to Galveston. It pretty much came right up the shipping channel. And with it, it was a Category 2, so it had strong winds, but with it came this just incredible storm surge. And since it came up the SIP channel, from what I've heard, the island kind of flooded from back to front. So the seawall didn't quite do maybe as much as it could have, just given the way that the water was distributed. Next to Galveston, if you take a ferry over to the next, there's a small peninsula, and this is a figure here showing just how devastating the hurricane was for the peninsula. There's full-time residents that live in Bolivar Peninsula, but it doesn't have a seawall. All the homes are elevated and things, but it's right up on the coast, and so you can just see how devastating the storm surge was on the peninsula. So I moved to Galveston in 2014. So my wife and I were living on the island during Hurricane Harvey. As I mentioned, and if you talk to people who lived on the island versus those who were living closer to Houston or on the mainland, the experience of Hurricane Harvey was very different for those who were living on the mainland. All of the images people were seeing on the news those were all happening in areas, in downtown Houston, League City, Clear Lake, those types of areas was where most of the flooding was taking place. Harvey, it made landfall quite a bit south of Galveston down the coast in Rockport, Texas. There, it made landfall at a Category 4 hurricane, major wind event, and then it just kind of slowly worked its way up the coast. And it was kind of bouncing off the coast back into the Gulf, regaining energy and moisture, and then just dumping just an incredible amount of rain over the Galveston, Houston area. At that point, it wasn't a major wind event. It was all entirely a big rain event, but it was just an absolutely massive storm. So that gives you a little bit of context of kind of the Galveston, Houston area, and a little bit about Texas in particular. I'm going to talk a little bit now about kind of more generally, the effects that climate and weather disasters have on the health outcomes of older adults. So there's growing evidence that indicates that major climate and weather disasters disproportionately affect older adults. And this is for many different reasons. Older adults often have chronic health conditions that may require regular care, such as dialysis if they have diabetes. They may have reduced, social networks or limited financial resources, which could make evacuating, recovering from a storm, particularly challenging. It's really the kind of days, weeks, and months after a major disaster has happened that older adults are especially vulnerable. And then nursing homes in particular are especially vulnerable during the immediate aftermath of a major natural disaster. This mainly because of their complex medical needs. Many nursing home residents have physical and cognitive limitations. They might have multiple chronic conditions. Many rely on staff to meet their daily care needs. And so they're really quite vulnerable to hurricanes and other types of major natural disasters. So most research on the effects of major weather and climate events on nursing home residents has focused on hurricanes. These are hurricanes occurring in the Gulf region, also in Florida, Atlantic coast. And so there's a lot of evidence to indicate that nursing home residents are at an increased risk for poor outcomes in the weeks and months after a storm. So this includes increased rates of 30 and 90-day mortality. There's elevated hospitalizations and ER visits. And there's also a few studies that have found that among long-term residents, they can experience an increase in their dependence in activities of daily living. However, certain nursing home populations may be more vulnerable after a hurricane. So this was a recently published study in the Journal of the American Geriatric Society, where they looked at the relationship to exposure to Hurricane Harvey and mortality among both short-stay nursing home residents as well as long-stay nursing home residents. And the way this study was set up, and this is how a lot of studies in this area of research are done, is they'll basically look at mortality or hospitalizations, whatever the healthcare outcome is, over a certain period after the storm, and then they compare to residents who are living in the same nursing homes, 2 or 3 years prior. So in this study, they were looking at mortality in the 90 days after Hurricane Harvey made landfall. So this was happening in 2017, and they compared those mortality rates to residents living in the same nursing homes in 2015 during that same time of year. And so as you can see in the figure, this here is showing the percent change in the relative risk of mortality among nursing home residents. And here it's split between short-stay residents and long-stay residents. Overall, you can see long-stay residents had higher mortality relative to short-stay residents. But it was mortality among residents who had chronic obstructive pulmonary disease that were really driving this increased 90-day mortality among the long-stay residents. And the investigators didn't include this as part of their analysis, but in the discussion, they talk a little bit about, because of all of the flooding and the substantial rainfall that occurred, that would lead to things that might exacerbate respiratory conditions, in particular mold. And so that's kind of their hypothesis as to why COPD residents may have had particularly high mortality after Hurricane Harvey. there's been a lot of research kind of showing that exposure to these natural disasters has consequences in older adults' health. And that's led to some more investigation to some particular kind of mechanisms or reasons why those associations might be occurring. There's been a couple of studies that looked at the association between power outage and nursing home resident outcomes. A major factor in how well people do after a storm, and people can speak from experience, is how robust the local and state infrastructure is for sustaining and restoring electricity. And so this study was looking at Hurricane Irma in Florida, and they found that the association between nursing homes experiencing a power outage during Hurricane Irma, they found a significant association with 7-day mortality and 30-day mortality, but they didn't see an association with hospitalizations over a 30-day period. But basically, experiencing a power outage was associated with these worse outcomes. But like the study that I just showed on Hurricane Harvey, this association, in particular among mortality, seems to be a bit stronger among long-stay nursing home residents compared to short-stay nursing home residents. So those are people who might be in a nursing home after a hospital stay for some type of rehabilitation, and ideally would be returning back home into the community after discharge. So this slide is a little bit of an aside, but I just wanted to take a little bit of time to acknowledge that nursing home staff and administrators are often put in incredibly challenging or impossible situations. When there's kind of early warning that a hurricane might be coming, we get weeks in some cases notice that a storm might be kind of forming in the Gulf, and so there's plenty of time to prepare. But usually that preparation kind of the decision is around whether or not to evacuate. And so for staff and administrators, this can be an incredibly challenging or impossible decision to make. Hurricanes can make sudden changes in their path, right up until they make landfall. A lot of times the storms will just really rapidly intensify in terms of their strength. And so it's not uncommon for a tropical storm to then turn into a Category 4 hurricane within just a matter of a couple of days. And so even though we have a lot of notification that the storm is coming, it's really up until landfall that things can certainly be uncertain. And so it's usually after the fact, after a storm has happened, that there was maybe a lot of public pressure to have evacuated the facility. People might remember seeing a photo from a nursing home in Texas during Hurricane Harvey of residents basically sitting in waist-deep water. And so there was just a lot of questioning as to, well, why wasn't that facility evacuated? Well, the storm had made landfall 200 miles away from Galveston and was kind of making its way up the coast. And so it just would have been difficult to kind of foresee kind of what would have happened. And so that can just really kind of weigh on a person in terms of deciding whether to evacuate a facility. Evacuating is not an easy task, especially for nursing home residents. In the time that I've lived in Galveston, we've had to evacuate once in 2020 or 2021 for a hurricane, and even just evacuating just the things that we had from our apartment is not a fun experience. And so you can imagine that the complex needs of nursing home residents can make evacuating a facility incredibly difficult. And there's actually research that has shown that evacuating can actually be harmful to residents. There was a couple of studies that have been done showing that residents who were evacuated from a facility had elevated mortality and hospitalizations after a storm relative to residents who had sheltered in place. So it just kind of adds to the complexity and the challenge of kind of deciding whether to evacuate a facility. So that all kind of leads me to some of the current work that I'm doing with some students and colleagues, looking at the emergency preparedness for hurricanes in particular among nursing homes in Texas. So because different parts of the country are prone to different types of disasters, CMS basically takes an all hazards approach to emergency preparedness. And so they have 26 or so items that basically look at how well a nursing home is for any type of kind of natural or man-made disaster. Nursing homes are kind of evaluated on their compliance with these different measures during state inspection surveys. And so because it's an all hazards approach, they're fairly broad, but some of them are fairly relevant or especially relevant to hurricanes. These are the ones that I'm showing you here in terms of whether the facility has sufficient emergency and standby power systems, what their policies and procedures are for sheltering in place versus evacuating, and if they've made arrangements with other facilities to receive their patients or residents in the case of an evacuation. So there's not a lot of research that's been done using these CMS emergency preparedness measures, but there's a few notable exceptions. This study in particular, Dr. Festa and her colleagues have done a paper looking at the association between nursing home exposure and whether the nursing home is located in a storm surge inundation zone. They've done this paper. They've done a similar type of paper looking at nursing homes in California and the Pacific Northwest who are located in forest fire zones, if that's an area of interest to people. But this is an interesting study because they were able to geocode all of the nursing homes in the Gulf Coast and then in the Atlantic Coast regions. So they included nearly 6,000 nursing homes, of which about 10% of the nursing homes were located in an area that would put them at risk for experiencing a storm surge inundation of at least 2 feet or more. And they also looked at 4 feet and 8 feet storm surge inundation. You can see here in this close-up of the Louisiana coast just how many nursing homes are located in these coastal regions and would be at risk for pretty substantial storm surge. As part of their description analyses, they reported that facilities that were located in these storm surge zones tend to have slightly higher CMS health inspection ratings, but they didn't have no noticeable differences in terms of star ratings for quality and staffing. Those ratings were pretty similar between the exposed and unexposed nursing homes. This slide here is showing the results for the association between being located in a storm surge zone and being compliant, or I'm sorry, having a deficiency in one or more emergency preparedness measure. And so you can see that the association between being in a storm surge zone and the adjusted odds of having one or more deficiencies varies based on region. So nursing homes that were located in the western Gulf of Mexico, those who were located in a storm surge zone, they were less likely to have one or more deficiencies on the emergency preparedness measures compared to nursing homes in the mid-Atlantic region. Those nursing homes that were in a storm surge zone, they actually had higher adjusted odds to have one or more deficiencies on an emergency preparedness measure. The other 3 zones, there wasn't a statistically significant relationship between location and deficiencies on emergency preparedness measures. So with that as kind of some background, that really made us think a little bit about some potential next steps in this area of research. And so we were thinking about how hurricanes are increasing both in frequency and intensity, and while nursing homes on the immediate coast are going to be the most at risk and the most vulnerable to the consequences from a hurricane. The impacts of a hurricane can be felt, far inland. In some cases, tens and hundreds of miles, depending on how large the storm is. And because of this increasing frequency and intensity and just the general aging of the population, there's going to be an increase in the number of nursing homes, the number of nursing home residents who are going to be vulnerable to the effects of hurricanes. And so we were interested to see how this might also be related to nursing homes preparedness for natural and man-made disasters. So in this study, we've been using data from all CMS certified nursing homes in Texas. There's almost 1,200 nursing homes in Texas. For nursing home characteristics, we've been using publicly available information from CMS, and we've also been using publicly available information from the state safety inspections for emergency preparedness deficiencies for the nursing homes. And then we've been using data from this, it's called the First Street Foundation, and they have publicly available aggregate data that looks at 30-year risk of major flood or wind events for properties at kind of different levels of geography, from census tract all the way up to the state level. I'll explain a little bit more in the upcoming slides. But we're really interested in nursing homes that are located in counties that are, at real high risk for kind of future major wind or flood events, as indicated through the First Street Foundation data. So our nursing home characteristics that are coming from the CMS data, we're looking at their location. So we first kind of grouped them based on whether they were located in a coastal or a non-coastal county. We're looking at their ownership, their overall star rating, so 1 to 5 stars, with more stars being reflective of just better overall quality, and then size of the nursing homes in terms of the number of beds. And then our main dependent variable here is simply whether the nursing home has a flag for being deficient on 1 or more emergency preparedness measures over the last 3 surveys. And so this is from roughly 2021 to 2024 was the time period that we've been looking at. So a little bit more information about the First Street Foundation and their flooding and wind data that we've been using. So they have a large team of climate scientists that have been putting together these different data sets that can be used for research purposes, but they also work with different insurance companies and things to help with evaluating property values and things. So basically, they look at the topography of an area, the characteristics of a building or the characteristics of the property. They use hurricane modeling and they use climate projections. They have a very complex methodology that I'm not going to try and convince people that I know how to explain, but they basically use all of this information and assign each property in an area a score of 1 to 10, with 1 being minimal risk for a major event in the next 30 years to 10 being the most extreme. So First Street Foundation makes available to the public this aggregate level data where it's looking at the percent of properties. We're interested in county, but it's the percent of properties in a county with a rating of minimal, moderate, severe, or extreme risk. So we don't have in this study information on individual nursing homes or individual properties, but we know if the nursing home is located in an area where the percentage of kind of buildings in their county fall in these different kind of risk categories. And so our main kind of independent variables here, we're looking at, kind of categorizing the percentage of properties as, about 3%, 3 to 5%, 5 to 10%, and then greater than 10% of properties in a county that are at severe to extreme risk of having a major flood event in the next 30 years. The risk for wind events is much higher, and so we kind of grouped it roughly into tertiles where nursing homes being located in a county with either less than 33% of properties being at severe to extreme risk, 33 to 66%, or more than 66% of properties in a county being at severe to extreme risk for experiencing a major wind event. So our analysis was fairly straightforward. Our outcome, we're looking at just 1 or more emergency preparedness deficiencies. So we did a series of logistic regression models adjusting for the nursing home characteristics that I shared earlier. We did 2 types of analyses. First, we were just looking at whether there was a difference in the adjusted odds of having 1 or more emergency preparedness deficiencies, simply based on whether the nursing home was located in a coastal county or not. And then among non-coastal counties, we looked at the percentage of properties at severe to extreme risk for flooding and wind events to see if that was associated with adjusted odds of having 1 or more emergency preparedness deficiencies. This is our descriptive characteristics. So we had about 13% of nursing homes had a deficiency in 1 or more of the emergency preparedness measures. There was some differences based on ownership. So the difference between profit and government-owned facilities was statistically significant. And we see a little bit of a trend in terms of lower percentages of nursing homes having 1 or more emergency preparedness deficiencies in relation to higher overall star rating, but this difference wasn't statistically significant. and the size of the facilities was pretty similar in terms of the number of beds. So this is a map of Texas showing the location of all of the nursing homes. And then in blue are the coastal counties, and gray are the non-coastal counties. And so you can kind of see here, like this is the cluster of nursing homes for Houston. This would be San Antonio, Austin. This is the Dallas-Fort Worth area. So you can see where, you know, in the larger cities, obviously there's going to be a lot more nursing homes. And Harris County, where Houston is considered a coastal county. So all of the nursing homes in Houston get kind of gathered together into the coastal category, coastal county category. But as you can see in the table, the percentage of emergency preparedness deficiencies was lower among coastal county nursing homes relative to non-coastal county nursing homes. And this was statistically significant after adjusting for the nursing home characteristics. So this map, this is showing, I guess I'll point out a few things here, kind of the distribution of where the counties are in terms of the percentage of properties that are at severe to extreme risk for experiencing a major flooding event. So obviously you can see all of the coastal counties are in that kind of highest category. So they all have at least 10% of properties in the county are in that highest risk group. But you can see that even in the inland counties, you know, this may not necessarily be flooding from a hurricane, but you know, even in the very far inland counties, there's potential for you know, severe to extreme risk for experiencing a major flooding event. And while we see kind of a trend toward nursing homes being located in counties with, you know, a higher percentage of properties at severe to extreme risk, having a lower percentage of having any emergency preparedness deficiencies, we don't see that association is statistically significant, even though the odds ratio is quite, you know, is a pretty meaningful effect size. This is the result for here looking at the wind, experiencing a major wind event. Again, obviously the coastal counties are going to be at the greatest risk for this, but even as far inland as this is San Antonio and Austin. So even really far inland, you know, there's a large number of properties or a high percentage of properties that are going to be at severe to extreme risk of experiencing a major wind event within the next 30 years. And you can see that there's this association between nursing homes being located in counties with a higher percentage of properties being at severe to extreme risk, having lower adjusted odds of having any deficiencies on the emergency preparedness measures. So just to summarize, I know that was a lot of text and things, but basically Texas nursing homes in higher risk locations were less likely to have any emergency preparedness deficiencies. And so Texas nursing homes, but even non-coastal counties, should be aware of the increasing risk for major flooding and wind events. So here's where I'm going to shift gears a little bit. Kind of highlight some of the recent work that my colleagues and I have been doing, looking at other types of kind of major events that have been happening in Texas. And kind of the backdrop to this is that, you know, the repeated occurrence of major weather events in specific parts of the country, you know, in Texas, it's hurricanes, you know, we have kind of a certain level of familiarity and preparedness when it comes to hurricanes, tropical storms. We know generally when they're going to occur, you know, we kind of know what the plan is in terms of kind of preparing for them. But increasingly, major weather events are happening in regions of the country where people do not expect them. And so for Texas, these weather events are coming in the form of extreme, or I guess relatively speaking, extreme cold. So this is a photo from 2021, a major winter storm that I'll highlight here, where just an unprecedented amount of snow, ice, and power outages is kind of the main concern here. So people, I don't know if people remember Winter Storm Uri, or if that sounds familiar, but it was a major snow and winter storm event that happened across the country. You know, here it really was from Texas all the way up to Minnesota. That brought an unprecedented amount of snow to the Texas area. So this happened in February of 2021. At that time, my wife and I, we were vacationing in Canyon Lake, Texas, and just to show some photos of the area the morning after the snowfall. We were snowed in basically with 2 inches of snow, maybe a little bit more, but it was a very hilly area, so we basically had to walk to a convenience store to get supplies for the next couple of days. This is a photo of us getting ready to head out. And then earlier this year in January, the southeast part of the United States was hit with Winter Storm Enzo. That this is a satellite image that got some went viral, I guess, where it was showing all of this snowfall along. This is where Galveston is here and Houston is here, but especially among like Louisiana, Mississippi, Alabama, just incredible amounts of snowfall. This is a photo of my wife and I, our 19-month-old son, who, even though I'm from Michigan, we've been up to Michigan for Christmases and things. It just didn't happen to be when there was snow. So I find it kind of funny that his first snowfall didn't happen in Michigan, but in Texas. So we got a couple of inches of snow, so just enough to be able to go out and enjoy it a little bit. Yeah, so if Winter Storm Uri, if that doesn't ring any bells, you may recall it being this major winter storm and freeze that occurred for about a week-long period in February back in 2021. And as I mentioned, even though it was a widespread event, I mean, pretty much the entire kind of middle part of the country was affected by this winter storm, Texas got a lot of attention because of the widespread power outages that occurred. So the maps that I'm showing here are from the New York Times, showing just how severe the power outages were across Texas. You can see in particular on the Monday, Tuesday, and Wednesday of that week, almost a third or a little over a third of residents had no power during that time. And so that's when everyone, if they didn't know in Texas about ERCOT, everyone knew after this week. So the Texas power grid is independent from other power grids across the country. And so when there's times of real high demand, the Texas power grid can't draw energy from outside of its grid. And so ERCOT had to use rolling blackouts to avoid a total catastrophe to its power grid. It was close, but fortunately they were able to save from a major disaster occurring, but it was still a major event for the entire state of Texas. And so the winter storm had disproportionately affected older adults. This was from a final report that the Texas Department of Health Services put together. And they found that of the 246 deaths that they attributed to the winter storm, almost 60% of those deaths occurred among adults aged 60 and older. This led to a really well done and extensive special report by the U.S. Senate, where they really looked closely at the effect that the winter storm had on nursing home residents and just how severe the impact was. So the map here, this is showing the percentage of nursing homes in a county that reported an incident during the winter storm. And by incident, I mean it was including things like losing power, having problems with the generator, having to evacuate residents, having a water shortage. Large parts of the state were under boil water notices. There was a major problem with having burst pipes. So nursing homes were experiencing all of these things as well. And so even though Winter Storm Uri, for Texas at least, was a pretty unprecedented event, relatively little research has been done of its effects on nursing home residents, an exception being one study that looked at changes in nursing home staff hours during the winter storm. And so we were interested in how trends in healthcare use and mortality, so important nursing home resident outcomes, might be different according to whether a nursing home reported losing power or water during the couple of days of the storm. So I'll move a little bit quickly here. So for this study, we used data from Casper for information on nursing home characteristics. We used the minimum data set for information on resident characteristics, and then we got the healthcare outcomes from Medicare fee-for-service claims. And then we were able to get data from the Texas Health and Human Service Commission. They had done a statewide survey of nursing homes where they reported whether they experienced one of the events that I mentioned in the last slide. So here we had data on a little over 1,200 nursing homes, and we identified 245 of which reported experiencing some type of power outage or water outage. And so this could include a burst pipe, loss of water pressure. There was kind of a broad category of nursing homes that fell into the water outage. We excluded a few nursing homes because those nursing homes didn't have long stay residents. We were particularly interested in the long stay resident population. And so we ended up with 231 nursing homes, or a little over 8,500 residents that were in our kind of exposure group, and then 943 nursing homes, which included almost 37,000 long stay residents in our kind of control group. These were nursing homes that did not report experiencing a power or a water outage. So just a little bit more about the measures. So the water outage included nursing homes that had no water, a water shortage, or they reported having a burst pipe. And then the outcomes, we were interested in clinician visits to the nursing homes, whether residents had emergency department visits, whether they had hospitalizations, and then their mortality. And we were looking at this over a 6-week period after Winter Storm Uri. For our nursing home measures, we're looking at bed size, number of beds, whether they were located in a rural or urban area, ownership status, and then we had kind of the typical demographic characteristics for the nursing home residents. For our statistical analysis, so we did, as I mentioned, 6 weeks before and after the Winter Storm Uri, and so we were able to use a difference in differences design using 2-level logistic regression models, and we're basically interested to see, was there a difference in these outcomes in the 6 weeks after Winter Storm Uri, according to whether a nursing home reported having experienced a power outage or a water outage. So this map here, again, this is a map of Texas showing all of the nursing homes. The black dots, these indicate the nursing homes that did not report losing power or water. And then the red dots, these are nursing homes that did report losing power or water. The percentage of nursing homes that reported losing power or water was highest in the Dallas-Fort Worth area. So here, so that was about 23% of nursing homes. And then also in the San Antonio, New Braunfels area, about 22% of nursing homes reported losing power or water. In Houston and Austin, it was quite a bit less, about 10% of nursing homes reported some type of outage. This is the nursing home characteristics according to whether the nursing home had an outage. Here we didn't see any major differences in terms of location, bed size, or ownership status. In terms of the characteristics of residents in the nursing homes, here we found small but statistically significant differences in terms of age, residence, race, and ethnicity, as well as their whether they were on their Medicaid coverage. So this first set of results here, this is showing the findings for mortality. So this is the weeks leading up to Winter Storm Uri. This is the week that Winter Storm Uri happened. And then this is kind of the time period that we're most interested in, the 6 weeks after the storm occurred. And so you can see that for no outage facilities in blue versus power outage and water outage facilities in orange, a fairly similar trend in terms of mortality. With an increase occurring for power outage facilities during the week of the storm, and then a somewhat kind of persistently slightly higher weekly mortality for those who nursing homes that experience the power or water outage. And based on our differences in difference design, we did in fact see that the facilities that lost power or water did have a slightly higher mortality in the 6 weeks after the winter storm. Just real quickly, again, just kind of looking at the time here, we didn't see any significant differences in our other healthcare outcomes. So this was the trends in percentage of long stay residents who had a clinician visit. And so obviously you can see there's this big impact during the week of the winter storm, but it kind of returns back to kind of typical levels in the 6 weeks after. These are the findings for emergency room visits. Again, we don't see significant differences based on the difference in differences analysis. And then same for hospitalizations. no statistically significant differences. So just to summarize, so it was common for nursing homes to experience a loss of power or water during Winter Storm Uri. And this was associated with a small but statistically significant higher mortality among long-stay residents in those nursing homes. But again, we did not find an association with some of our other measures of healthcare utilization. So just real quick, I'd like to acknowledge my colleagues who've been working with me on some of this research. It's been really enjoyable, and I've had the pleasure of working with several students in this research. And then I would obviously like to thank the National Institute on Aging for supporting this work, in particular the UTMB Pepper Center. This is a bibliography depending on how interested people are in this research. These are for some of the studies that I cited throughout the presentation, but then there's a few other papers that have found interesting or have been influential in the field. So people are welcome to have my slides after this presentation and look at these references. So with that, I'll be happy to take questions or comments for consideration. Thank you.
Thanks, Brian. That was a great talk. I can't help but think about our nursing homes here in Chicago, where we do, especially in the suburbs of the city, have risk of tornadoes. And I wonder, you know, since I personally I'm not an expert in that, but I wonder how prepared our local facilities are should that happen. And even if we know that we are in a high risk area, as your data pointed out, even if you're not in a known high risk area, you're still at risk, given the instability of weather these days. Let me see if okay, I see one question in the chat. Is there information on cause of death for the increased mortality that you showed?
Yeah, so I believe in the state Senate report, they have information about cause of death. And then in that other state report that, you know, where they attributed about the 250 so deaths, I believe they talk a little bit about cause of death. In our analysis with the Medicare claims, we didn't look at cause of death. I would have to talk with some of the analysts to see if we'd be able to kind of get access to that information. But the state of Texas, and as part of their reporting, they do kind of document, you know, hypothermia was a major cause, but then kind of subsequent like complications, kind of attributing whether it was like, you know, a car accident or a fall. They kind of had different categories of how they group the deaths and how they attributed them to the winter storm.
Other questions? You need to either unmute, you can't unmute, put your questions in the chat. Sorry, I misspoke. Please do put your questions in the chat.
Yeah, and then I'll say, I mean, you mentioned, you know, hurricanes in the Midwest. So I'm from Michigan originally, so we didn't get a ton of.
I guess I meant tornadoes. Did I say hurricane? Yeah, I meant tornadoes. I'm sorry, I meant tornadoes.
You said tornadoes. I just have it on my mind, I guess.
Yeah.
I mean, at least I feel like, I mean, tornadoes would be just so incredibly challenging because they're so sudden. I mean, there's really no advanced warning. I mean, I feel at least with hurricanes, I mean, it's incredible the technology. They've, you know, we'll get alerts, you know, 2 weeks in advance that there's, you know, something possibly developing, you know, thousands of miles away. And so we're, you know, for like 2 weeks, everyone's kind of on pins and needles a little bit to see, you know, as it kind of comes into the Gulf, is it going to peel off and go to like Florida or, you know, Louisiana, or, you know, is it going to be, you know, south of Texas? So there is a lot of time to kind of build up, but within, you know, 2 to 3 days before it makes landfall, that's when you kind of get these slight variations. We had a hurricane that made landfall in the Galveston area this past July, and it was an instance where kind of last minute it just made a quick little shift, and it completely changed the kind of the trajectory for the Houston Galveston area.
Yeah, it's hard to know. You know, do like you were saying, do you evacuate all these people that's not without risk? You know, it's hard to know what to do because it can change. Okay, a couple questions here. Are there any documentation regarding less access to oxygen sources or food, medicine in nursing home residents during the winter storm in Texas?
That's a good question. So we didn't consider that. We talked with nurse practitioners as we were kind of developing the study to kind of think about what types of outcomes would be relevant to look at, and they were thinking about, and we ended up not being able to do this exactly, but with power outages, like powered like beds and things, like kind of mobilizing residents and seeing if there might be an increase in like pressure sores and things. There would be information, I believe, on whether residents are receiving any kind of like medical device and things, and I think those are the residents that are get the most attention from what we were discussing with the nurse practitioners in terms of making sure that if they're the backup power supply, if it's not able to power the entire nursing home, it's at least that energy is kind of prioritized to the residents who are on some type of medical device that does require power and electricity.
Yeah. And someone did say here that Hurricane Harvey was associated with disruptions to oxygen and medication. Another comment, great presentation and resourceful use of public data. What are your thoughts on whether CMS emergency preparedness measures are good enough? Should they be more or less strict?
Yeah, so I was introduced to a faculty member at, I believe, Texas State University, who was a former nursing home administrator, just talking about this research. And he was saying kind of a couple of things, like one with like any kind of like state surveys that asks about kind of outcomes after a storm, the administrators, like they're just so focused on just immediate recovery that providing that type of information is just challenging and isn't always a priority. In terms of the state surveys, I've been trying to get more information about just kind of what goes into that evaluation in terms of how they kind of decide whether a nursing home is meeting expectations or whether they're deficient. As far as based on the data, it looks like it's basically a dichotomous, did they meet it or not? So, like the item about, the evacuation plan, they may have one, but from our data, we don't see, the details of that evacuation plan. In terms of which residents to prioritize under which situations, where would they go? So I think that's where I would be interested to kind of see, maybe even like talk with some of the surveyors just to kind of see how they go about that evaluation process. So I guess that's not really answering your question, Kevin, as to whether it's good enough. I think it's hard to tell. The fact that I guess we find an association, I guess, to me suggests that they're telling something that, administrators, whether they're more attentive because they see themselves as in a high risk area, they're more, vigilant and doing more with their preparedness, or vice versa, state surveyors might, be going to a facility that they see as being in a high risk area. So maybe they're a bit more strict in how they're evaluating those facilities. In the FESTA paper that I highlighted, they talk about that in the discussion section, I believe, about just how the location, it can kind of go both ways in terms of more strict evaluation or more attentive compliance.
Other questions in the last few minutes here? I don't see any anything else. Yeah, just that there's a lot of variability. Anything that disrupts transportation, infrastructure can affect the supply chain. Yeah. Well, thank you everyone for those comments and questions, and it was a very, very interesting talk. So thank you for joining our pepper rounds today. Really appreciate it. Thanks for coming to speak to us. Look forward to seeing your next steps in your research. And thank you everyone for joining. We'll see you again next month.
Yeah, thanks. I really enjoyed it.
Thank you.